This partnership came to be by, I would say about 10 years worth of working together to try to create health insurance that is attractive and health insurance that is effective to serve the needs of our employees.
The partnership has been ongoing for 76 years, and we are very proud to be the carrier that Topeka Public Schools has chosen for all these years.
The wellness plan that we had previously, it certainly improved health and wellness for many employees in our district, but it certainly was not, as of this past year, effective for the entire workforce. And that's evident by the fact that the cost that Blue Cross and Blue Shield was incurring to pay claims far exceeded what they were taking in as far as our premium. We had, for the entire year, had a projected increase in our premium rates to be 18-19%. That is the highest forecasted increase that we have had since I've been with the district. That increase of 19%, what that means is that each and every employee who was a member of the plan was going to incur an additional $92 a month increase in their premium costs. So that is why we entered into discussions to try to figure out how we could offset that increase. If we don't meet these goals, that is the increase that we will have to bear. Whatever dollars that we incur as far as a premium increase, that increase will be passed on to employees. We would rather employees have those dollars to spend how they choose, in supporting their families, improving their standard of living, rather than investing those dollars in their health care costs. We came up with this plan that served our need to keep premiums flat, their need to have a plan that they felt would help them be able to justify basically writing off $2.7 million in losses. If employees met what I consider to be very reasonable goals, that not only do we have a zero premium increase this year, we're guaranteed of having a zero premium increase the following year.
The projected increase through September 30th claims points to a 24% increase, which equates to $123.27 per month per person increase.
Rather than continue to negotiate on the dollars, we welcome partnering with them based on wellness and making their employees healthier than the dollars. The new requirements for this new plan will include the employees completing a health assessment, which they've done for a number of years already. They will have a biometric screening that will be provided by a carrier, and the district has agreed to set up shops for those. And then they can also go to their primary care physician if they so choose to. And then for those that miss some markers, some health issues, they will be asked to participate in our Healthy Options programs with our disease management nurses.
Once you know that you have a health challenge, it's really important that you then start making changes in order to get those challenges back under control. In the programs, individuals will work with a nurse over the phone to help them set goals, help them make progress toward those goals, and understand the challenges that they may be encountering. We have a number of nurses who work at Blue Cross and Blue Shield. They are Kansas nurses. They're right here in the Topeka area, and they are highly qualified to help folks improve their health. Our programs are accredited. They are structured in order to be able to develop and result in good outcomes.
A lot of it had to do with finding out I had cancer 10 years ago, and then that's when I started eating healthier and trying to exercise more often. Disease management's helped me a lot because I've done the weight management, and now I'm also doing the stress management. The weight management, she would call me once a month and she would give me healthy hints of how to eat, counting your calories and drinking way more water and making sure you get all your food groups in. And it was very helpful because once a month we would have a conversation about just whatever we needed to talk about when it comes to food and exercising. I would just advise doing the weight management or stress management or whatever other managements we have, and it will help you live a lot longer.
The board approved this health care plan for multiple reasons. The first being that it was going to be a big savings for the patrons. It enabled us to increase salaries across the board. And two, it helps the employees become more physically fit, more nutrition based, and so that we can be proactive on their health as opposed to being reactive.
We know that we have employees that do not have a primary care physician. This is certainly going to encourage those employees to obtain one. We know that we have employees that may not be regular as far as physicals, as far as getting the testing that a biometric screen provides done on an annual basis. I personally know the benefit of making sure that you are aware of what is going on with you from a health standpoint. The importance of being proactive. I can sit here and tell you that if it wasn't for the fact that I was proactive in identifying some health issues, personal health issues, if I hadn't identified those and addressed those, I wouldn't be here talking to you today.
One of the great opportunities that individuals who work at USD 501 have is that they have clinical staff right in their district. They have clinical staffs in their building, but they also have a corporate nurse, Missy Getzinger. Misty has a professional responsibility to both support her employer and all of the employees here.
I think it's huge to support and encourage one another through this process because change isn't easy. If you have support of your peers or your coworkers, it helps the process go a little more smoothly. Several resources for employees. One of the biggest resources that they have available to them in their own environment or their own building is a wellness captain. There should be a wellness captain in every building. If an employee doesn't know who their wellness captain is, they can certainly go to their principal or supervisor and ask who their wellness captain is. They would go to the wellness captain if they had questions about their insurance as far as the new wellness program, you know, the biometric screening process, the dates of that. They have questions about the health assessment form, anything like that. They can certainly go to that. And if they can't find out the answer, then the wellness captain acts as a liaison between the district and Blue Cross and Blue Shield and the employee. If any of the biometric screening results are abnormal, they will need to get counseling either from their primary care physician or from me. If an employee chooses to go to their primary care physician, they need to have the preventative health screening assessment form filled out. They need to check that they've had the biometric screening done, but they also have to check and have dated that the counseling was done if they have any abnormal results. Then the physician has to sign that, date it, and then it gets sent into Blue Cross and Blue Shield, where they can bring them to me and I can turn them in for them. I am bound by the state of Kansas with my nursing license that all information that is brought to me is kept in a strictly confidential manner. I cannot disclose that information to anybody, so it's kept between the employee and myself. If they want to involve their primary care physician also, they can certainly do that.
I really want to assure all of the employees that any communications that we receive at Blue Cross and Blue Shield from your physician or the results for the biometric screening that we will receive from the vendor that is completing those is totally confidential. The only individuals at Blue Cross who will even see those results are our nurses, who also are bound by confidentiality and liability and legal protections. We only need to see those results because we are looking for the opportunity to help individuals improve them, and we may need to know where those parameters are in order to be able to help folks in those goal setting and strategy sessions.
Please be assured that your biometric screening results will not be used in the rating of the district's plan.
We at Blue Cross have the same challenges, the same issues when it comes to living healthy lives that the people at USD 501 do. And so we have had the same challenges, and so we have already begun to address them with our employees. We've had a program over the past several years to try to encourage people to live healthier lives. We've had some success, and we've learned a lot from it as well. And so what we're doing here is trying to take some of the things that we've learned and work with USD 501 to help them live better lives. And we're very excited about this partnership. It's something that we think if we can get even better, if we can get right with USD 501, it's something that we can help people around the state live healthier lives with.
It's very important that all people take this seriously, because not only does it help with our rates, which is a very small part of this, but it helps people become healthy.
So the students of USD 501 are the future of this community. The community, the health of the community, the culture of the community is so important to us that the learning environment that our students have here in this community is everything to us. It's our future. And so a big part of this project is making sure that the learning environment there in all the schools here in this community are as good as they can be. And that begins with the professionals, the teachers, the paras, the administrators, everybody else in USD 501. And we want to make sure that they have the best program here, the best opportunity to live a healthy life that they possibly can.
There are two ways that we could think about the work culture, and one of them is my individual culture. So simply, where do I operate and what do I make easy or hard for myself in my immediate environment? In the bigger culture, particularly in a school district, there are lots of food opportunities. So to, again, take a long, hard look at, are there any small changes that we could make in that culture that are going to help all of us in making healthier choices? Not changing all of it, but simply starting at small changes to see where can we set ourselves up to be more successful. I encourage all of us to think about what are your goals and why do you want to reach them. I personally think the why is more important than anything. Because if I know the why, if I realize that I really want to be engaged with my children, grandchildren, I want to take that trip, I'm a lot more likely to stick with the goals I have.
What we want to make sure is they understand, that everybody at USD 501 understands that we are their partner. They are not alone in this journey. We are all in this together, and we hope to be with them on every step of this journey all along the way.